What's up, guys? Welcome back to your channel.
Welcome back to the Nursing in a Nutshell series.
What are we doing today?
To get you guys caught up, last video was NCLEX. So now we're going to be on... Yeah, but now we're going to be talking about people who are getting ready to find a job. Getting their applications sent in, getting their resumes in.
Getting their clothes in.
Yeah.
Looking prepped and fresh.
So what we're going to do is go over the different types of jobs as LVNs that we can get. Maybe our own experiences or our own kind of thoughts on each type of
job setting.
Yeah, job setting.
Mainly the job setting that we've been exposed to.
Yeah, we can only see from other people's perspective, but you know.
Yeah.
The ones we can touch on, we will, and then maybe give you guys some tips and tricks about interview process.
Because those could be really nerve-wracking and scary. So we got you guys.
So let's just get started. Let's list out what the specific
so we're gonna be
job settings are.
We're gonna be talking about convalescent hospitals, locked unit, subacute setting, rehab setting, and I think that's it, right?
Yeah, and then but there's other
of course
things.
There's many other options.
You could be a travel nurse. You could be a hospice nurse. You could be a home health.
You don't necessarily have to be a bedside nurse either.
Yeah.
You know, there's a lot of different routes you can take.
You could even land a hospital job.
Hospital job. No, there's a lot of different LVNs who also go for like those facial jobs that you can get. You work with...
You could be no,
you got excited.
You could even be one of those like fancy IV kind of places.
Yeah, you can get your IV.
You just get your IV cert and then you just bam.
And that's all you do. So there's many routes you can take.
Yeah.
But the ones we took were bedside care and those job settings. So, which do you want to start with?
Let's start with long-term.
Long-term
like
settings. Like the ones that...
That's going to be like mostly the generic settings that most LVNs are going to come into.
You might just start with that.
You might just start with that because that's like one of the easiest jobs to land in a way because they're always short. And they always need people.
Also the best ones in the sense where you're going to get a lot of experience from them.
Yeah, because it's going to force you to be fast.
Yeah.
So when you get to somewhere else and you have that feeling of...
Honestly, if you start there. If you start there, you'll be able to be anywhere.
Yeah.
Okay.
So let's touch up on it. Let's go with my experience. First job I had was long-term, short-term, in a subacute center. So it's kind of like a trio effect. But it was still the ideology of having like a long-term care facility where, newsflash, you get a lot of patients. A little too much. But I was mainly in the subacute side and kind of like the short-term side where people kind of move in and out every now and then. But that's a lot of work. It's a lot of work. You get a certain amount of time, but your minimum is like you have like 30 patients. So you get really like challenged to find out a way to start getting your meds out faster, getting your BP checks done quick, your blood sugars, getting all these things done, and then you gotta document them, you know. I think that's the tough part right there. Yeah. Because I was in a computer access.
Oh, computer system. Yeah. So a lot of facilities you either get paper form where you do all your documentation through paper, or computer, which is more modern.
Yeah.
Modern.
But I think the paper version is easier than computer because paper, all the checks and stuff are there, but with the computer you have to mark that you gave the medication, but then you have to go to the station and then do more checks that you could even do just on a paper mark. So it's more time consuming going back and forth after you finish your med pass. Yeah.
So patient wise, how are they?
Patient wise?
Yeah, like it was short term?
Yeah, short term.
So they would just come in and come out?
Not as much though.
Oh.
But it's kind of like some technical short term. Like some of them have been there for like years, but Other ones kind of come in there for 2-3 months and then leave.
Oh, okay.
That's what
Once
I've
they get
heard.
better.
Once they get kind of better, they get discharged.
Okay.
So
how did you like that setting?
it sucked for me.
It sucked.
I didn't like it. It was a lot of, you didn't have any time to do anything. Sometimes you'd have to just fake your lunch and then you're still working through passing a medication, or it just didn't give you enough time to like learn. It was just more like you needed to just get a system to get it out quick. Just pop them out, you know? So, but only thing, the best takeaway of it, I guess, was learning time management.
Okay.
Yeah, trying to be quicker with everything.
So in your first job or so, you're going to learn that a lot, how to manage your time, because that's one of the main things you're going to have to get down fast. Time management. Yeah. So for me, my first job was a convalescent hospital / locked unit. So it had 2 different divisions. The bottom one, which is where I was at, was a convalescent hospital. And I dealt with a lot of people who had dementia, schizophrenia, had a lot of anxiety, a lot of mainly psychological issues. And on the locked unit, if you guys don't know, those are people with even more psychological issues that they have. And they're in the locked unit for a reason. You know, they might be a potential threat to others or themselves. And they're able to walk around. They're moving and grooving. So they're in the locked unit, so they can be supervised a lot more. And where I am, my patients were mainly bedbound. So they wouldn't really move. They were just in bed or in their wheelchairs. Now for that one, it was a really tough experience, but it was the best one I've had for me.
Why do you say that?
I had about almost 60 patients.
60.
Yeah.
60. When we get to what our current jobs are, you'll see the difference. But 60.
Yeah. I had about 60 patients to take care of. By that I mean giving medication, giving their injections, making sure they're okay, documenting for them, doing their treatments. Like, it's a lot of bedside work I had to do for each and every one of them, and at a timely manner.
Yeah.
So the reason why I say I really enjoyed that was because it made me really quick, really have my time management down and know my own form of how I like to work. So that was my first job, and I was nervous and freaked out every single time because I'm dealing with a lot of mentally ill people. So it's crazy all the time, but I ended up loving them, and they ended up loving the job. So it made me really quick to my feet. And I take that from that job, and I really enjoyed it. So if you're looking for a convalescent hospital, keep in mind that you might have 30, 40 plus patients, and all in your care.
Here's another bomb. You are the charge nurse.
Oh, yeah.
So when things go bad, change of condition, doctor calls,
Charge nurse,
family calls.
Yeah. Meaning you're the person in charge of your whole section.
You gotta take care of the phone calls. You gotta carry out the orders.
Yeah, you have to talk to doctors about any issues.
On top of 30 to 60 patients.
Yeah.
For your day.
So keep in mind, if you want to go to a convalescent hospital, it's a lot of work. A lot of patients you have to take care of. And a lot of doctors you have to talk to.
Yeah.
Also, keep in mind, doctors not so nice, so don't get offended by that.
That's just commonplace.
It's
right
just
there.
the way it is.
But
okay, second job. Which new one?
Hospice.
Hospice.
Hospice is a hit or miss. We got friends that
Either
done
hospice is either for you or it's absolutely not for you.
Pros: lots of money. If you are good with your visits, you make your plans, you will be going in and out. Boom, 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 boom. Cons: if you don't have visits, you don't make money. If you don't have clients, you don't make money.
Right.
And the drive is long. You want to be driving most of the day.
You don't
want to
be driving so long and then lose money instead of getting money.
So, I mean, those are the things, but that's also an option. We have friends that actually do hospice, and they're doing well. But with our experience, when we tried
hospice.
It wasn't that good.
It didn't work out for us. We thought, man, hospice is going to be for us. It sounds so
that's the money,
cool. But it really wasn't, and that's the craziest part.
Yeah.
Like, I had my visits, but I didn't enjoy it as much. Like, I came from a facility before I did hospice, so I absolutely missed facilities. But I think maybe if I started off as hospice right off the bat, it would be different. So if you're thinking of hospice off the bat, go for it, you know?
It's definitely less stress, though.
It is
like,
less
as long as you have
stressful.
your patients and stuff, it's less stress because you're on your own time.
Right.
You're doing your own 45 to an hour visit per patient. That is pretty much, you're just there to make sure they're comfortably going.
They're comfortable.
Yeah.
Exactly.
But
I miss the facility stress.
Yeah. But that's the same idea as a home health. Like, you're taking care of somebody at home for long periods of time. Or, you know.
For home health, you kind of do more, though.
You have to give their medication.
You give them their meds.
Their treatments.
Yeah, it's a little more. But look into them. Maybe you'll enjoy them.
Yeah. And then the last one that we could actually touch on is subacute.
I have another one.
You have another one? We'll go with yours first.
Okay. So the other job I also worked at was a rehab center.
Whoa.
I worked at a rehab. And that one, they're in for rehabilitation, whether if they broke some type of bone or they had, let's say, a critical thing like pneumonia. They're in there to get better a lot of the times. Some of them stay for a long period of time and others just come and go when they get better. So I worked at that setting. It was pretty cool. Definitely they're more alert, meaning they'll talk to you, they'll tell you what's wrong. Family super involved, which is pretty cool. But it's the same mentality where I didn't get 60 patients. The most I would get would be 30 patients. But the paperwork is so much more. It's a lot of paperwork.
Paperwork.
Yeah, it's a lot. You're basically the charge nurse, the RN, and sometimes the treatment nurse all put together. Because one of the lack of staff.
Always short staff, no matter what. If you're an LVN, it will always be short staffed.
Yeah.
Always.
But in the rehab center, sometimes you're just gonna have to be all that. It's just how it is. You have to provide that care.
It is.
So definitely a lot more work and a lot more paperwork. But I'm very thankful for that job because I feel like that job made me become the nurse that I am now. Like, I feel like I'm well knowledgeable of different areas. Like, I know treatment, I know how to do paperwork, I know how to talk to the doctors, you know. I know all of that and how to do it. Like, I can handle...
Look at that confidence.
No, I just have the experience.
Oh, okay.
It just made me handle stress well. So, if you're looking for that and maybe being more comfortable with yourself, rehab centers aren't bad either. I think in that setting they're better than convalescent because you get less patients. You know?
I know. I mean, I don't know, but you're telling me. Last one before we get into tips and tricks for interviews is subacute. What we are currently at right now. Different vibe.
That's our first subacute setting. So subacute basically means you are dealing with people who are on ventilators, who need assistance with, being able to breathe properly. A lot of respiratory problems. They're not really alert. Some of them are, but a lot of them have trachs. No, almost everyone have trachs and G-tubes and a lot of things going on. So we take care of them.
Yeah.
First reaction when I went in though, I was super overwhelmed because there's a lot of tubes being connected and you don't know what it's for.
Yeah.
But
like anything, it's all about seeing it, repetitive. Then it becomes kind of like, it's just
I know
there.
what this is for.
Like, oop, I hear a sound. I know exactly what it is. Let me just turn it off.
Yeah.
You know? It's one of those things. And I think
I like to be cute.
It's a good place to learn a lot. And, of course, because they're really critical, you don't get that many patients.
Right.
The most have we gone is 8. But even then, in that shift, it's a lot of stuff to do.
But even if you get 8 patients, you still have a lot more bedside care
because
to do.
Where we work is one of the only subacute facilities that the trach care, meaning, they have ties to keep them down. You got to clean them up and replace them and stuff. The LVNs do it.
Not the RTs.
Not the RTs.
We do it.
Every other facility,
the
RTs usually just do it.
But we have to do it.
Yeah.
Which is, give and take. You learn more experience through that.
you get the hang of it.
You
and
get
you're
your
able to figure it out.
clinicals done in that
Yeah.
in our facility.
Mm-hmm.
But
Would you recommend that?
I would recommend it because you get the best of everything. They have treatment, they have G-tube, they have trachs. Like,
You're gonna learn how to manage your time for
you're
sure.
gonna learn the things you didn't learn in school. You're gonna definitely learn at a subacute setting. Would I recommend it for be your first job? No, just because you need to be confident to a certain point. You can't be really too nervous or too like just not trusting yourself, because these are people that 100% depend on you. So I wouldn't recommend this to be your first job, but eventually I would.
Well said right there.
Thank you.
think so.
Thank you.
Now, with the job descriptions out of the way, really quick, let's give you some tips on the interviews. Really quick.
First, you gotta look presentable.
Usually, dress shirt, tie, dress pants, dress shirt.
Dress pants. Same for women. The same thing.
Just keep it clean, keep it cut.
Professional.
Know what you're going to talk about.
Be confident.
Have your resume, your cover letter. What else am I missing?
And get, like, they're gonna ask you definitely questions like, why do you want to work here? Why did you choose this place? Why do you think you're ready to work here? What are qualities you can bring to this job? How would you react to high stress settings? Like, those are questions that they're always going to ask you. Always. So be prepared for those.
Yeah, it's never a bad thing to prepare for the interviews. To think about maybe what the questions might be and how you're going to answer them. That's only going to help you. Because I know for sure when I do interviews, I'm really anxious. I'm nervous. So when they ask me things, it just flows, but if you practice it, it'll be better said.
Make conversations with them, having them laugh with you. It's always a plus. They're going to be like, oh, that's a cool person, that's someone I want to hire.
You just got to leave a lasting impression,
Yeah.
Wherever
Smile.
you try to go.
Exactly. All your manners got to be on point on that day. So just, trust yourself, the main thing. Usually they go pretty fast.
They do go pretty fast.
They just want to know the main points. Like, don't overly talk, just get the main points done, and they're gonna be like,
all right,
you're hired.
Yeah, you get hired right on the spot, or they give you a call the next day.
Yeah,
but you know what, keep on applying,
keep on trying, and don't give up. If the job's not for you, that's totally fine. There's so many more options.
Yeah, it won't hurt.
Don't stop at your first option.
Yeah, you want to try it out, don't ever think you're doing a disservice if you leave. But do it for yourself. If you don't like the job, leave it.
Right.
It's not like at any moment they're going to be willing to drop you. So, do it if you enjoy it, then stay. If you don't, then move on to a different type. There's plenty of facilities or different types of...
Work somewhere where you enjoy it. Because you're going to be taking care of someone else's life. And that's pretty serious. So enjoy it.
Enjoy.
That's it, guys, for this video.
That's going to be it.
We hope it was insightful and you could take something out of it.
Hopefully you guys will be able to get a job and you guys are going to actually enjoy it.
Right. Okay.
Thank you guys so much for watching. This is Life with L&R. Never seen...